OCT angiography demonstrates flow in retinal angiomatous proliferation and chorioretinal anastomosis. Anastomosis with type 1 neovascularization by abnormal vessels from the retina may manifest as type 3 neovascularization, that is, retinal angiomatous proliferation or RAM or chorioretinal anastomosis. We present 3 such cases in which OCT angiography demonstrated flow within the anastomotic networks. Our first case is of juxtafoveal telangiectasia with retinal angiomatous proliferation, a 45-year-old male with visual acuity of 6/24 in the right eye and counting fingers in the left eye. Fluorescein angiography, although conventionally used to diagnose these lesions, requires multiple serial frames for early detection. As we can see here, the mid frames are indicative of retinal angiomatous proliferation in both the eyes and the late frames show high flow signals. OCT angiography demonstrates the origin of the flow within the retinal arteriole in the inner retinal layers, forming the type 3 intraretinal neovascular complex as seen on the left panel. The right panel shows the corresponding layers of the retina on OCT B scan as we scroll down from the superficial retina through the deep capillary plexus, then the outer retina, and finally communicating with the type 1 neovascularization within the choroid. OCT angiography, a dye-less angiography, is a novel imaging technique to visualize retinal and choroidal microvasculature in a non-invasive way. Our second case is also of bilateral juxtafoveal telangiectasia with retinal angiomatous proliferation, a 76-year-old male with visual acuity of 660 in the right eye and 6'9" in the left eye. Fluorescein angiography reveals blocked fluorescence due to the underlying hemorrhage in the right eye with weak signals in the late frames. The left eye shows hyperfluorescent staining of the scar tissue. OCT angiography of the right eye reveals 2 different foci of type 3 neovascularization. As we see now, one under the fovea highlighted by the yellow arrow, and the second one inferonasal to the disc highlighted by the red arrow. These 2 lesions demonstrate supranormal flow. In this way, dynamic evaluation of different retinal layers enables to detect different foci of retinal angiomatous proliferation and determine the course of the lesions, delineating their complete morphology. Our third case had received intravitreal bevacizumab injections in both the eyes for type 2 neovascularization. His visual acuity was 6'9" in the right eye and 6'36" in the left eye. Fluorescein angiography reveals hyperfluorescence in a spoked wheel pattern in the right eye and late staining of the scar tissue in both the eyes under the fovea. OCT angiography reveals an abnormal vascular network with a supranormal flow beginning right from the inner retinal layers up to the margin of the detached retinal pigment epithelium. The OCT B scan on the right shows the hyperreflective mount corresponding to the detached pigment epithelium with type 3 neovascular complex, making it difficult to differentiate between the two. OCT angiography has a potential for increasing our understanding of these lesions and may help in differentiating between retinal angiomatous proliferation and chorioretinal anastomosis, the two variants of type 3 neovascularization. Thank you.